for Behavioral Health Services, Dr. Brian Ahmedani. Welcome to the show.
Well, thank you so much for having me. It's a pleasure to be here.
Well, it's great to have you here because it's a couple of cool honors. You are one of the 2026 Time Magazine 100 health list of the world's most influential leaders in health. Congratulations, that's really cool.
Thank you so much. It's an incredible honor and really just a great honor for our team.
Well, you are not only honored by Henry Ford, but Time Magazine, and also Cranes recently named you as one of the most influential healthcare professionals, particularly in behavioral health. So those are pretty cool honors. So spotlighting influential leaders in health who've pushed new ideas. You were at the forefront of something, but this new idea is actually like almost 30 years old.
Yeah, it is. It's amazing.
It's called Zero Suicide, and it's a model that you came up with that is designed to reduce or eliminate suicides. And 30 years ago, we as a society, we don't talk about suicides. Does that make it that much harder to have a focus on suicide prevention when it's just something we don't really want to talk about?
Yeah, I mean, suicide prevention has been stigmatized, and it's something that most people don't want to talk about. Most people don't want to talk about going to get mental health services. They don't want to get help when they're struggling, and oftentimes in society we encourage that by telling people they just need to get better, feel better. But we really are focused on changing that perspective and helping people get the care that they need.
Well, the best thing is it works. Your model actually works, the Henry Ford Health Zero Suicide model, and it reduces the rate of suicide by how much?
Well, there's a lot of findings because we've implemented it in places all over the United States and all over the world. But the original model at Henry Ford, our team did an incredible job of redoing the infrastructure, the structure of our system. We reduced our suicide rate by almost 80%.
80%. Yeah. Wow. So in numbers, real numbers of people, how many lives has this model saved?
Oh, well, at Henry Ford, definitely hundreds, thousands of lives,
wow,
certainly in the Detroit area and expanding now.
That's really amazing. So that's why it's lasting. It really works. Other people, now it's not just Henry Ford, people, are they stealing the idea from you, Brian?
Well, you know, it's interesting because we implemented this program. Our team at Henry Ford is incredible leadership, clinical leaders, researchers, originally back in 2001, and also with a lot of insight from patients that were receiving care and wanted to tell us how they wanted to receive care. So it originally was implemented back in 2001, and we immediately reduced our suicide rate by almost 80%, but it's hard to trust that right away, you know, and we wanted to make sure that it was real and sustainable. So the program had been implemented for about a decade before we really got the information out to the public when we could really trust the data from a research perspective. We had sustained that program now for 25 years and continue to have one of the lowest suicide rates in the country for a healthcare system.
So it's magical, really, in that it saves that many lives, and it seems so simple. I think about when I go to a Henry Ford doctor. There's a bunch of questions they ask, and it's like, wait a minute, I have a headache. It's nothing, but it's about, you know, is there anybody at home that's bullying you, or do you feel safe? And those kinds of questions, are they part of is that the beginning of the model?
Yeah, absolutely. So there are a lot of questions that you get asked at your doctor every day when you visit, and are all risk factors for suicide. And those factors are part of the puzzle to identifying whether or not we can help you get care, and is the start of a pathway to, you know, get further services to help you get healthy.
So what was it that got you started to look into solving the suicide problem?
Well, You know, that's an interesting question. I think, most of us in this field have been impacted by, seeing people who have struggled with suicide risk in and around our lives and in the community. And I think that's exactly what it was, is that there are a lot of people struggling around locally here in Jackson, around the entire state of Michigan. Our suicide rate is about almost 15 per 100,000 in the state of Michigan. We're losing a couple thousand people a year here, and it's devastating. Kids who are losing 50, 60, 70 years of life, and we have an obligation in behavioral health and a responsibility to do something about that.
We hear someone dies from suicide, and people maybe close to them say, I didn't see it. It was a shock. Are there some things, have you identified contributing factors to suicide?
Well, there's a lot of contributing factors, and many of them are things that you would just obviously think of, like mental health conditions or exposure to trauma. But there are a lot of other things too, things like medical conditions or acute stressors in our lives, things like job loss, things like marital disruption and financial struggles and trauma exposure. And sometimes we don't know what to say to people, but I think one of the most important things that we can do in our community is be willing to ask people if they're okay, and really specifically ask them, are you thinking about suicide? It's a hard question to ask. You don't feel like you should ask that because you never think that anybody's actually feeling that way. The reality is that when we ask that question, it opens the door for people to actually respond. And when they do, then we can help them get the care that they need.
So it's at that point during that interview, and it's not, you don't have to do a full psych evaluation of someone. You can do it at a regular intake for someone with just a few series of questions. And then would you kick them up to the next level when you get the worrisome answers?
Yeah, sure, that's exactly right. So we start asking questions just about your general overall health, and all of those things are potential indicators of suicide risk. And so then once we learn a little bit more, then we can ask further questions. And the thing I think that's so scary for patients, for people, is they don't want to tell you about their suicide risk. They don't want to tell their healthcare providers because they're scared about what will happen.
Right.
But the reality is now is very different than how we experienced those things even 3, 4, 5 years ago, 10 years ago, 15 years ago, where it was automatically send somebody to the emergency department. We have real interventions that can help people right then. Brief interventions that can be delivered by a primary care doctor. When we just implemented this program in the entire healthcare system in Washington State, in primary care, we reduced their suicide rate by over 25% just by doing a very minor brief intervention right there in the clinic visit. And then we can connect people to outpatient care, do an assessment, connect people to the care that they need that's linked with the risk level that they have, and get them the treatment that they need based on their level of severity. And then a lot of that care actually happens outpatient. It doesn't happen in the emergency department or the hospital, so people can get healthy.
It's time consuming though, isn't it? It requires an investment in the treatment plan, typically.
For patients and providers, I mean, for patients certainly it's being willing to answer the questions, but it's also being willing and recognizing that there is help, that there's a treatment, and some of that, the beginning of that treatment is less than 15 minutes, and right there in the doctor's office, and that alone can help significantly reduce risk. But then there's additional care that we can give people in the form of very specific psychotherapy approaches that can help reshape the way that your brain is thinking and help you to live a healthier life.
And I think that those are the two components that are really the most difficult to believe that they work. And that first, that in the assessment, you're able to get the truth. You're able to find out in just 15 minutes the real deal. and then you're able to successfully prevent that person from taking their own life. And you have such great statistics of how successful this is. Do people find it hard to believe?
Yeah, I mean, they did for a long time, and that's actually why we did this huge program across the country. We implemented this, we got some funding from federal funding to do a big study across 10 million people a year in 5 states and 6 health systems to look at this, because there was so much uncertainty about it. People didn't believe it. And so then when we implemented this program across all those places, and then we found that at minimum people were reducing suicide rates by 25, 35, 45, 50, over 50% in some cases. It's hard to dispute now. It was very clear that it works, and it's also shown to work in other countries like Australia and England, in other places around the world, where we're now working in more than 30 countries.
So all over the world. And there's, besides the healthcare setting, you've got this in prisons, schools, and you get the same level of rate of success there too.
Yeah, well, our research showed that about a little over 80% of people who die by suicide have a healthcare visit right before they die, within weeks and months. So our primary focus has always been in healthcare settings: reshape the way that we provide care, make sure people don't fall through the cracks, get them connected to services, and then deliver evidence-based care. But there are a lot of people that aren't in a healthcare system when they're at risk. They're experiencing an acute stressor. So the reality is in order to be successful, in order to reach people when they're at risk and where they're at risk, we need to partner throughout the community. So we've developed partnerships with jails. 20% of people who die by suicide recently in jail, according to our research. We've partnered with schools and community centers and service centers and even gun shops.
Your model is called Zero Suicide. I'm guessing that is your goal. Zero suicide.
Zero suicide is our goal. And a lot of people question that. How could you possibly do that? Well, the reality is that we believe that we must strive to prevent every single suicide. And so accepting a 5% reduction or a 10% or even a 50% reduction means that we're willing to also accept that somebody's kid or husband or sister or mother is okay that they die. And we're not okay with that. So we believe that there's an audacious goal, and that we're going to go after it, and that we're going to continue to work hard until we get there. The reality is we weren't sure, but at Henry Ford, in about 6 quarters in a row, about a year and a half straight, we did not have a single suicide.
Zero
suicide. Actually got to 0 suicides for about a year and a half straight. And so while people tell us that it's impossible, I can tell you that it is possible. And it's audacious. It's crazy to think that we should pursue that, and yet I can't think of any other goal for the world, for our community to pursue than to try to work together across our communities to prevent every suicide. And not only to prevent suicide, but to help people live happy and healthy lives. Brian,
you're right, it's audacious, it's amazing, and it's astounding. And thanks so much for sharing this incredible model with our viewers today. I'd love to have you back. There's so much more, but you can read a lot of articles, including Crane's, as Brian is one of Crane's notable leaders in behavioral health. He's written for AMA. He's director of Henry Ford Center for Health Policy and Health Services Researcher. Also part of My Mind. You head up My Mind, which is the state of Michigan collaborative on the very same thing, eliminating suicide.
Yeah, absolutely. Yeah, well, My Mind is our program across the state of Michigan. We're partnering with Blue Cross to implement this and over the next several years in every single healthcare system in the state.
Awesome. Keep up the great work.
Thank you.
And thanks for coming in today.
Thanks for having me.
Dr. Brian Ahmedani is one of Time Magazine's 100 world's most influential leaders in health, and director of Henry Ford Center for Health Policy and Health Services Research, and director of research for Behavioral Health Services. And he's today's Wellness Wednesday guest, presented by Henry Ford Health on JTV. Stay with us. We've got